Chapter 8 Safety and Infection Control Part 6 8. An 85-year-old man was admitted for surgery for benign prostatic hypertrophy. Pre-operatively, he was alert, oriented, cooperative and knowledgeable about his surgery. Several hours after surgery, the evening nurse found him actually confused, agitated and trying to climb over the protective side rails on his bed. The most appropriate nursing intervention that will calm an agitated client is A. Limit visit by staff. B. Encourage family phone calls. C. Position in a bright busy area. D. Speak soothingly and provide quiet music. Answer D. Speak soothingly and provide quiet music. 9. Miss Smith is admitted for internal radiation for cancer of the cervix. The nurse knows the client understands the procedure when she makes which of the following remark the night before the procedure? A. She says to her husband, please bring me a hamburger and French fries tomorrow when you come. I hate hospital food. B. I told my daughter who is pregnant to either come to see me tonight or wait until I go home from the hospital. C. I understand it will be several weeks before all the radiation leaves my body. D. I brought several craft projects to do while the radium inserted. Answer B. I told my daughter who is pregnant to either come to see me tonight or wait until I go home from the hospital. 10. The nurse in charge is evaluating the infection control procedure on the unit. Which finding indicates a break technique and the need for education of staff? A. The nurse aide is not wearing gloves when feeding an elderly client. B. A client with active tuberculosis is asked to wear mask when he leaves his room to go to another department for testing. C. A nurse with open weeping lesion of the hand put on gloves before giving direct client care. D. The nurse put on a mask, a gown and gloves before entering the room of a client on strict isolation. Answer C. The nurse with open weeping lesion of the hands put on a gloves before giving direct client care. 11. The nurse observed a new staff nurse who is changing a dressing on a surgical wound. After carefully washing her hands, the nurse then sterile gloves to remove the old dressing. After removing the dirty dressing, the nurse removed the gloves and done a new pair of sterile gloves in preparation for cleaning and redressing the wound. The most appropriate action for the charge nurse is to A. Interrupt the procedure to inform the staff nurse that sterile gloves are not needed to remove the old dressing. B. Congratulate the nurse on the use of good technique. C. Discuss the dressing change technique with the nurse at a later night. D. Interrupt the procedure to inform the nurse of the need to wash her hands after removal of the dirty dressing and gloves. Answer D. Interrupt the procedure to inform the nurse of the need to wash her hands after removal of the dirty dressing and gloves. 12. Nurse Jani is visiting a client at home, is assessing him for risk of fall. The most important factor to consider in his assessment is A. Correct illumination of the environment. B. Amount of regular exercise. C. The resting pulse rate. D. The status of salt intake. Answer. Correct illumination of the environment.